Okay, sorry, I will continue this topic. And the second one, vitamin A is required for the integrity of epithelial cells, especially for retinoic acid, regulates the expression of various genes, embryonic development, development of structure posterior to the hindbrain, example the vertebrae and spinal cord. Retinoic acid is also involved in the development of the limbs, heart, eyes, and ears. And for the retinoids are necessary for the maintenance of immune function, which depends on cell differentiation and proliferation in response to immune stimuli. And they are the structure of vitamin A. They are retinol. Retinol is the alcohol group. CH2OH. Retinol is the group of aldehyde. Retinoic acid is the group of carboxylic acids. And we can see this beta carotene. If it oxidizes, the beta carotene will be vitamin A form. And you must remember one molecule beta carotene is or equal with the two molecules vitamin A. Okay, we are going to factors affecting the vitamin A requirement. First one, the internal absorption. Dietary fat. Dietary vitamin A is digested in a micelles and absorbed with fat. In some studies, increasing the level of fat in a low-fat diet has been shown to improve retinol and carotene absorption and vitamin A nutrition. Other studies, however, have not demonstrated a beneficial effect of fat on vitamin A absorption. For optimal carotenoid absorption, a number of research groups have demonstrated that dietary fat must be consumed along with carotenoids because it can be the increase the absorption of vitamin A nutrition. Infections like gastroenteritis, respiratory infection, diarrhea, intestinal infection, and intestinal parasitism can cause the malabsorption of vitamin A. Food metrics. The metrics of food affects the ability of carotenoids to be released from food and therefore affects intestinal absorption. The rise in serum beta-carotene concentration was significantly less when individuals consume beta-carotene from carrots than when they receive a similar amount of beta-carotene supplements. So size reduction is mandatory for the absorption of the vitamin A molecule. Okay, the lower size of the food so it can easier to absorb by our intestine. Like is the principle between food metrics and food processing is same. The principle is the size reduction. The processing of foods greatly affects the absorption of carotenoids. The absorption of carotene was 24% from sliced carrots because the sliced carrots has we give the treatment like the size reduction. So the absorption of the sliced carrot is higher than the raw carrot. And then the absorption of carotene from homogenized carrots is higher than the sliced carrots. And Rock et al. Reported that the rise in serum beta-carotene concentration was significantly greater in subjects consuming cooked carrots and spinach as compared with those consuming an equal amount of raw carrots and spinach. So, size reduction, the lower of size reduction of the food is so it can affect to the higher the absorption it by intestinal. And for the nutrient-nutrient interactions for the iron, serum retinol concentration was positively associated with serum iron and ferritin concentrations. And the second one, combining vitamin A with iron supplementation was more effective in increasing hemoglobin concentration than was giving around iron alone. And for the zinc is required for protein synthesis, including the hepatic synthesis and secretion of retinol binding protein and transthyretin. So it causes zinc deficiency influence the mobilization of vitamin A from the liver and its transfer into the circulation. Carotenoids. Competitive interaction among different carotenoids like the beta carotene and lycopene. Okay, for the lycopene, Johnson et al. Reported that lycopene affects the absorption of beta carotene, and beta carotene can improve the absorption of lycopene. And the last, alcohol, competition with each other for similar enzymatic pathways. Potential for overlap in the metabolic pathways because both retinol and ethanols are the alcohol family or alcohol group. There is potential for overlap in the metabolic pathways of these two compounds, and it causes depletion of hepatic vitamin A concentrations in animal and in humans. Okay, we are going to the vitamin A metabolism. Okay, fat-soluble micronutrients, including the vitamin A and carotenoids, following the fat of lipids in the upper gastrointestinal tract. The first phase of the process of absorption is the dissolution carotenoids and vitamin A in the fat phase of the meal, and this phase is emulsified into lipid droplets in the stomach and duodenum. And next, the hydrolysis of ester of vitamin A in the duodenum. The luminal hydrolysis of retinal ester are like the pancreatic triglyceride lipase or PTR together with the pancreatic lipase related protein 2 or PRRP2. And next, the ester that have not been hydrolyzed by PTLH or CEH may be cleaved by mucosal enzymes. Given that a retinal ester hydrolase, probably due to phospholipase B, was identified at the brush border membrane level of rat and human intestine. Okay, finally, it is conceivable that some ester are taken up and checked by the intestinal cell and hydrolyzed intracellularly. Okay, this is the diagram of the metabolism of vitamin A. This is the brush border REH, retinal ester hydrolase. Okay, for the path of absorption, carotenoids and fat-soluble vitamins are incorporated with other lipids into the mixed micelles. So they they will uh, they will undergo absorption to the enterocytes, and mixed micelles are a mixture of phospholipid, cholesterol, lipid digestion products, and products of secretions in bile, such as bile salts. Mixed micelles are essential for the efficient solubilization of retinol, and especially for solubilization of the very lipophilic carotenoids. Retinol and some carotenoids enter the intestinal mucosal brush border by diffusion in accord with the concentration gradient between the micelle and plasma membrane of enterocytes. Some carotenoids pass into the enterocyte and are solubilized into chylomicrons without further change, whereas some of the provitamin A carotenoids are converted to retinol by a cleavage enzyme in the brush border. Okay, retinal ester and unconverted carotenoids together with other lipids are incorporated into chylomicrons, excreted into intestinal lymphatic channels, and delivered to the blood through the thoracic duct. Tissues extracts most lipids and some carotenoids from circulating chylomicrons. Most retinal ester are stripped from the chylomicron hydrolase and taken up primarily by the parenchymal liver cells. If not immediately needed, retinol is re-esterified and retained in the fat-storing cells of the liver. And next, for the circulation phase following hydrolysis of stored retinal ester, retinol combines with the plasma-specific transport protein, retinol binding protein RBP. You can assume it like the public transportation. Okay, RBP is the public transportation for vitamin A, especially retinol. This process includes synthesis of the unoccupied RBP. ApoRBP occurs to the greatest extent within liver cells, but it may also occur in some peripheral tissues. The RBP retinol complex, or hollow RBP, is secreted into the blood where it is associated with another hepatically synthesized and excreted larger protein transthyretin. So we can call the ApoRBP if the RBP is the unoccupied, but if the RBP binding with the retinol, uh, so we can call the RBP retinol complex. The RBP retinol complex equal with the hollow RBP. The transthyretin RBP retinol complex circulates in the blood, next delivering the lipophilic retinol to tissues, and its large size prevents its loss through the kidney filtration. RBP protects retinol from oxidation, while transthyretin stabilizes the retinol-RBP interaction. And how the vitamin A acts in the target tissues. Action it in target tissues, hollow RBP transiently associates with the target tissue membranes and specific intracellular binding proteins then extract the retinol. Some of transiently sequestered retinol is released into the blood and chunks and is recycled, conserved. A limited reserve of intracellular retinal ester is formed that subsequently can provide functionally active retinol and its oxidation products. These biologically active forms of vitamin A are associated with specific cellular proteins which bind with retinoids within cells during metabolism and with nuclear receptors that mediate retinoic action on the genome. And the last retinoids modulate the transcription of several hundred of genes. And also for the excretion, Vitamin A undergoes hepatic metabolism as a first-order process and is excreted via the feces and the urine. Unconverted beta-carotene is converted to the retinol in the wall of the small intestine. Retinol can be converted into retinoic acid and excreted into the bile and feces. Hollow RBP is filtered into the glomerulus but recovered from the kidney tubule and recycled. Normally, vitamin A leaves the body in urine only as inactive metabolite resulting from tissue utilization and in bile secretion as potentially recyclable active glucuronide conjugates of retinol. And this is the diagram of the whole of metabolism of vitamin A. And this is the mechanism action is the vitamin A absorption for the normal function and the storage of vitamin A in the liver. And this is the main dietary retinoids and carotenoids for the transport protein in the enterocytes. And this is the major extracellular and intracellular retinoid binding protein. Okay, for the hypervitaminosis and vitamin A deficiency, if the individual overdoses to intake the vitamin A, so we can call it the hypervitaminosis A. And the hypervitaminosis can result in toxic symptoms including liver damage, bone abnormalities, and joint pain, alopecia, headaches, and vomiting and skin desquamation. Hypervitaminosis A appears to be due to abnormal transport and distribution of vitamin A and retinoids caused by overloading of the plasma transport mechanism. And how if the person or the people lack of vitamin A? Okay, for the first one, the ocular for the A, eye lesion develop insidiously with an impairment of dark adaptation resulting in night blindness. Later comes dryness of the conjunctiva and cornea. The patient might tell he is feeling dryness in the eyes. Dryness of the conjunctiva is called xerosis conjunctiva, and dryness of the cornea is called xerosis cornea. Okay? The parents might describe the presence of whitish material in the child's eye, and clinically it's called Bitot spots. These are foamy and whitish like a tissue spots that develop in the lateral sides of the eyeball. The spots don't affect vision in the dialect. More severe VID or vitamin A deficiency will lead to corneal ulceration or extensive wrinkling and cloudiness of the cornea called keratomalacia. Xerophthalmia is a range of clinical signs secondary to VID. It includes night blindness, Bitot spots, corneal dryness and ulceration, and finally the occurrence of full-blown blindness. And the parent might notice the following when they compare their child to their peer group. Next, the skin dry. Skin dry and scalky skin and follicular hyperkeratosis may be seen on shoulder, buttocks, and extensor surface of the extremities. And the last organ systems, like the epithelial metaplasia in the urinary tract, may be associated with infections. Reflected by pyuria and hematuria, blood in the urine, and left in the disease state where what separation of the fontanelles and increased intracranial pressure might occur. Okay, um, thank you for your attention.